Histology of epithelium. So the learning objectives include different types of epithelium with examples, their distribution and function. Coming to epithelia, it is a tissue with one or more layer of cells lining the outer surface of the body or the gut or the surface of all cavities including ducts and glands. It lies on basement membrane. So coming to general features, cells are closely packed together. Intercellular substance is less. Adjacent cells are connected by cell junction called as desmosomes. Basal layer of epithelium rests on basement membrane. The epithelium is avascular and is nourished by diffusion from the underlying connective tissue. Functions. They are protective, they transport molecules, they make secretions, they absorb the material from the lumen, and also they help in detection of senses. They are classified based on its shape. Squamous is flattened, cuboidal is cubical, all sides are equal, and columnar is tall, that is there is 1:4 ratio. Simple epithelium has one layer of cells. Stratified epithelium has more than one layer of cells. So coming to classification, simple type are simple squamous epithelium, simple cuboidal epithelium, simple columnar epithelium and pseudo stratified columnar epithelium. Coming to multilayered or stratified, we have stratified squamous epithelium, stratified columnar, stratified cuboidal and transitional epithelium. So the picture shows the simple cuboidal which are equal on all sides, then simple squamous, they are tile-like and flat, and simple columnar, so that is the width is only 1 and the length is 4, and stratified squamous, there we can see a number of layers. Starting with simple squamous epithelium, these are thin flat cells, width is more than the height, the nucleus is flattened and seen as a bulge on the cell surface. Examples include alveoli of lung, epithelium, endothelium of the blood vessels and mesothelium of the pleura and pericardium. So you are seeing the enlarged picture of the alveoli showing the simple squamous epithelium. Then we go to simple columnar, rectangular shape, height is 3 times more than the width, the nucleus is in the base of the cell. Based on specialized structures present in it, it can be simple columnar epithelium like stomach and intestine, then ciliated columnar epithelium of the respiratory tract. Columnar epithelium, some have microvilli called striated border or brush border. These are present in small and large intestine. Some cells are also secretory columnar cells which are in the stomach and intestine, which are called as goblet cells. So the picture showing the columnar epithelium, they are tall and that is ratio is 1:4. Cuboidal epithelium, single layer, height and width are same, nucleus is centrally placed and the example is thyroid follicle. So the picture showing the thyroid follicle separated. So there are 2 follicles separated by cuboidal epithelium. Pseudostratified columnar epithelium. It is a single layer of cells with different heights of the cells on the basement membrane. Some cells reach the surface of the epithelium. Cells of this epithelium are of different heights, So their nuclei are located at different levels, giving the impression of a stratified epithelium, and the example is trachea. Pseudostratified ciliated columnar epithelium is shown in this picture. You can see different shapes of cells, and all are attached to the basement membrane, but they do not come to the surface layer. Then we go to stratified cuboidal. So there are two or more layers with cuboidal layer on the top, and the example is secondary ovarian follicle. So picture showing the stratified cuboidal epithelium. Then stratified columnar, two or more layers of columnar cells. On the top is the columnar, and you can see they are lining the ducts of stratified columnar epithelium. Stratified squamous epithelium, seen in areas where there is maximum friction, cells require constant replacement. Several layers of cells, deepest layer of cells are in contact with the basal lamina, called as basal cells. They are columnar cells. Middle layers cells are polyhedral in shape, and superficial layers are flattened, which are called squamous. There are two types, non-keratinized and keratinized epithelium. So the lining of the epithelium surface is usually wet. Keratinized stratified squamous epithelium surface is dry skin of the body, example. So picture showing the stratified squamous epithelium, non-keratinized, that is belonging to the esophagus. And stratified squamous epithelium, keratinized, which is the skin, example is skin. And another picture showing the stratified squamous epithelium, keratinized, that is example of skin. Transistor epithelium, multi-layered, histological difference by layer. Deepest layer is cuboidal or columnar. The middle layer is polyhedral, and the surface umbrella shaped or dome shaped cells. So these the transistor epithelium is seen in the ureter, urinary bladder, and part of urethra, that is prostatic urethra. So the picture showing the ureter with the transistor epithelium and the star-shaped lumen. Thank you.